At any given moment in your facility, the age range of your patients could span 6 decades or more in some cases. Each of these individuals will have different developmental needs as well as their medical needs. This video will focus on those developmental or age-specific needs based on Erikson's 8 stages of development. As you will see, age-specific care requires a team effort. From the time a patient enters your facility to the time they are discharged, nearly every department in your facility will need to address that patient's age-specific care. As an infant, Elizabeth, 5 months old, is in stage 1, trust versus mistrust. An infant is totally dependent for daily nourishment, shelter, comfort, and affection. Her basic needs include sleeping, feeding, sucking, bathing, cleanliness, and affection. Meeting these needs promotes trust. Mistrust, however, evolves from inconsistent care and unmet needs. The trust learned in infancy provides a foundation for trust and self-confidence into the next stages of life. Last night, Elizabeth was admitted to pediatrics with RSV. Hospitalization for the infant is a break in her daily routine and will lead to some mistrust. It is important to maintain as much continuity as possible. Turn off the lights during normal nap time. Provide stimulation through mobiles, mirrors, or soft music. Nursing, lab, radiology, and respiratory need to remember that if any invasive or unfamiliar procedures are required, a parent should be close by to hold and comfort the infant after the procedure. If a parent has stepped away, personnel should take the time to comfort the child. Nutritional needs will most likely not involve dietary in this case. If the mother is breastfeeding, she may request a breast pump to keep a supply of milk for when she has to be gone from the baby. If the infant is formula-fed, the hospital usually supplies several formulas. It is important that materials management keep all formulas well stocked in pediatrics and nursery. Consistent environmental conditions are important to the infant. A baby's skin is much more sensitive than that of an adult or even a toddler. Water and air temperature should be monitored carefully on pediatrics and the nursery. Engineering should also be aware that an infant will be more sensitive to noise during any remodeling or new construction. Samantha is 2.5 years old. Erikson calls stage 2 autonomy versus shame and doubt. Samantha is acquiring gross motor skills. Children in this stage begin to walk, talk, feed themselves, and help in dressing. They learn by imitation and repetition. In this stage, the parent guides the child's decision-making. At times, there is conflict between the parent's decision and the toddler's choices. If the toddler is degraded or shamed, doubt in her ability will develop. Positive feedback is essential for the toddler to gain autonomy.
Hi, I know she's sick and she probably won't tolerate this very well. We'll hurry as fast as we can. What's her last name?
Samantha is being admitted to pediatrics with a kidney infection. With a toddler, try to maintain as much autonomy as she is used to at home.
She goes to sleep around 2 or 3 and sleeps for a couple of hours.
Okay. Is there anything special we need to do for her before nap time?
No, she needs the blanket and the bear to sleep with, but
Nursing should assess her level of independence, such as potty training, feeding herself, and keeping her routine close to the one she is used to at home.
As soon as the matchmaker saw Mulan,
Incorporate familiar daily rituals, like reading a story before bedtime. She may want a favorite blanket, pillow, or stuffed animal with her. All employees should be aware that separation anxiety or stranger danger starts at 9 months through 18 months. Always encourage parents to stay with the child if possible to decrease separation anxiety. Noise is more of a concern with the parents of the toddler than the toddler herself. Engineering and maintenance should be sensitive of projects close to pediatrics. Don't start a noisy project too early and finish at a reasonable hour. Dietary is a big issue to this stage. A toddler's menu should include simple, familiar foods that are easy to eat. Adon is 5 years old, almost 6. Erickson refers to this stage as initiative versus guilt. They show initiative and drive as they learn more about their surroundings. They develop a conscience that tells them right from wrong. The preschooler has a vast imagination. Imaginary friends and play are important to this stage. He enjoys projects that push his imagination and help to develop fine motor skills. The child in this stage must learn responsibility for his choices without harboring guilt. The result will be a child with an objective to life. Adon is being seen in the ER for abdominal pain following a bicycle accident. Adon has significant tenderness in his upper left abdomen. Remember that a preschooler can produce some exaggerated ideas with his imagination. Suspend any ideas that he is being punished or that his injury is his fault. Explain any procedure before doing it.
Adon, we're going to need to do some studies to look and check out your belly, okay? What we have to do is we have to put an IV in your hand, so you're going to have a poke in this hand. It's going to hurt a little bit. We'll try to help out.
If possible, use a stuffed animal to demonstrate the procedure. Let the child demonstrate the procedure on the stuffed animal as well.
I don't want you to be worried about this. This isn't going to hurt you, and nothing in the machine is going to touch you, okay? It's just kind of like a big...
Because of his tender abdomen, the doctor has ordered an abdominal CT. The CT scan area can be intimidating and frightening. Explain what will happen in detail and eliminate any exaggerated ideas.
Okay, we're going to start taking the pictures now. I want you to take in a big breath for me and hold it in. Don't breathe.
Adon has a lacerated spleen and will go to surgery from ER. Talk about the people he will see. Let him try on a hat and a mask. Explain why he won't be able to eat anything before surgery. Show him pictures of your facility's operating room so he can become familiar with the surroundings. Explain the length of his surgery with something familiar to him, like a favorite TV show. Allow the parents to be with the patient in the holding area as long as possible. Erickson refers to stage 4 as industry versus inferiority. Meet Mackenzie, age 10. At this stage, she is ready to take on responsibility and carry a task from start to finish. This youth desires achievement. Their activity increases. Working, learning, and playing with others teaches cooperation and teamwork. How she measures up to her peers is a great concern to this stage. Inferiority may surface if the child is not recognized for her achievements. When the child in this stage is praised for her accomplishments, she will continue to increase in confidence and proficiency. Mackenzie was with her older brother on their riding lawnmower, slipped off and caught her right foot under the mower. She will be hospitalized for several days, receiving multiple surgeries to graft the wound and antibiotic therapy. At this stage, alternative pain treatments can be effective, such as positioning, relaxation, and music. Mackenzie is used to being busy and will become bored easily. Make a daily schedule and calendar. Involve her in the schedule. Encourage her to keep a journal of her hospital stay. Aggression activity is important in this stage, especially after such a traumatic event. Make punching bags to hit. Explain any procedures in detail before doing them, especially invasive procedures like an IV or blood draws. Diet will be important for optimal healing. The school-age patient will need a variety of choices since her stay will be longer. She will need to be encouraged to eat healthy foods and not just the candy she will receive from visitors. Engineering should be sensitive to any maintenance items in a room with a school-age child, especially if they will have a longer stay. This age group tends to be less patient when it comes to these problems. Housekeeping becomes an important issue in longer stays. Mackenzie will have many guests and her garbage will fill faster. To accommodate her situation, you might want to check her garbage more than once during the day. James is 15 and a sophomore in high school. This stage is known as identity versus role diffusion. This stage is marked by puberty. Body changes of puberty cause the adolescent to feel self-conscious. Physical appearance becomes more significant. They separate from their parents and begin to experience life for themselves. They strive to excel in a particular area of interest, such as sports, the arts, and education. Privacy is also an important issue with adolescents. When the adolescent feels conflict with their identity, role confusion results. However, when he masters this stage, loyalty to others will result. James was in a car accident yesterday with some friends. He was thrown from the car and sustained minor head injuries and a fractured pelvis. James will need total care while his pelvis heals. He will have a Foley catheter until his bladder starts working again. Remember that privacy is a prime issue. He will want to stay as independent as possible.
What are you so upset about?
He will most likely take his frustrations out on his family and sometimes staff. Female staff, especially nurses, will need to be sensitive of his concerns for privacy. Bed baths and help to the bathroom will be major issues.
My name's Kaivi. I'm a physical therapist.
James will require physical therapy. It would be ideal if the therapist could be a male with whom he could relate and bond. With all staff, the adolescent should be encouraged and understood. Avoid giving advice and establish trust through active listening. Cam is 27, just graduating next month with a bachelor's degree, and will be starting law school in the fall. Cam is in stage 6, intimacy versus isolation. In this stage, the young adult builds stronger ties in every aspect of their lives, socially, occupationally, and sexually. Dedication to education increases as he strives to provide income and increase his economic status. Their social circle increases both at school and with co-workers. The young adult develops a need to love and show commitment to the opposite sex. Cam is engaged and will be married during the summer break. He is learning commitment, compassion, and selflessness. This relationship will provide stability to a challenging stage of life. Some young adults isolate themselves and build barriers for emotional protection. Mastery of this stage, however, results in a commitment to society. Cam was admitted to ICU 2 nights ago with diabetic ketoacidosis. He has been a diabetic since age 10. He has been mostly compliant with his disease. This past month, with the stress of school and an upcoming marriage, he has not been getting enough sleep and has been less compliant with his diet. The patient in this stage will be anxious to return to work or school. Often they will deny or mask symptoms, hoping to return to normal activity sooner. They will also be worried about how their hospitalization will affect their limited financial resources. They usually prefer their spouse or significant other to help with their daily care if they are unable. A thorough assessment of Cam's case by the nursing staff revealed marked depression this past month. Cam feels like his diabetes is getting in the way of his career and marriage goals. The stress and depression have led to non-compliance with his diabetes. A social worker was brought in to evaluate his condition. Erickson refers to stage 7 as the generativity stage. Generativity is the commitment to care for and advise others. Isaac is 48 years old with a wife and 5 children. The middle-aged adult develops this sense of generativity through the care of his family. Isaac works as an advertising executive. The adult in this stage strives to maintain the economic status he has earnestly worked to establish. This can cause stress when these expectations are not achieved or are unrealistic. A person that does not achieve generativity will stagnate. Having children will usually prevent stagnation. As the adult becomes responsible for bringing up the next generation, he masters this stage of development. Isaac was recently diagnosed with early-stage colon cancer. 3 days ago, Isaac had part of his colon removed.
This has been a major surgery, and I know you're anxious to get back to work.
Can I go back Monday?
Well, I think that's going to be pushing it a little too soon.
Isaac will have a temporary colostomy for about 6 weeks. Nursing personnel should evaluate Isaac's family, work, and leisure concerns. Address ways to help lessen concerns and encourage delegation at work and at home. Keep the patient and family informed about the diagnosis and treatment plan. Especially with this situation, Isaac will wonder how this will affect his work and family structure. All staff should be sensitive to his frustrations and concerns. Encourage family visits. Help him to self-prioritize health maintenance and involve him in decision-making. Listen and learn from your patient. He may offer advice and counsel, especially to younger staff, as part of his caring for the next generation. Joanna is 68 years old. Her husband died 2 years ago. She has 3 children, 8 grandchildren, and 2 great-grandchildren. The primary goal in this stage is to achieve a sense of integrity. This person is looking back, evaluating choices made through their lifetime. Factors such as family relations, economic status, and interaction with society affect her feelings of accomplishment. She will center her thoughts around family to feel this sense of integrity. As she watches her children raise another generation, she will find satisfaction in her individual life. Some elderly people look back on their life and see only mistaken choices and view life as a waste of time. As they finish their life, they will feel hopelessness and despair. Mastery of this stage, however, results in feelings of distinction and honor for the life lived. Because of severe osteoporosis in her left hip, Joanna had total hip surgery 3 days ago. Nursing personnel should assess whether the patient feels hopelessness or despair. Assess the family structure. All personnel should be good listeners and allow her to reflect on positive memories. Encourage family visits. Let the family know how important their visits are to the patient.
Has your family been in to visit you this morning?
Yes, they have already. It's so nice of them to come. I appreciate it.
All patient care personnel should provide encouragement. As a person moves into stage 8, they again become sensitive to environmental surroundings. Their skin becomes more sensitive to temperature. The elderly individual is not as steady with balance. Handrails should be secure in patient rooms and walkways. Rooms and hallways should be free of any clutter that could increase fall potential. The elderly patient's safety should be a concern with all hospital personnel. You can see that every patient has individualized needs, depending on their situation and their stage of development. Effective age-specific care is a team effort. As you all focus your work on the individual and their age-specific needs, you will achieve new heights in patient and job satisfaction.